Hi, my name is Mani Dami, and for my innovation project, I'm looking at Breathe2Relax, portable tool for teaching diaphragmatic breathing in PTSD treatment. What is PTSD? Hansel and Damore, 2005, defined post-traumatic stress disorder (PTSD) as significant post-traumatic anxiety symptoms occurring more than 1 month after a traumatic experience. Some of the symptoms include recurrent, intrusive, distressing memories of the traumatic event, intense psychological distress when exposed to certain cues, which are reminders of the event, outburst of anger, hypervigilance, and increase in heart rate, sweating, and anxiety. Background: prevalence rate in war veterans. According to the National Center for Post-Traumatic Stress Disorder, PTSD has a high prevalence rate in war veterans. According to NCPTSD, PTSD occurs in about 11 to 20% of veterans of the Iraq and Afghanistan War, about 10% of Gulf War Desert Storm veterans, and about 30% of Vietnam veterans. So what is it costing to the Department of Veteran Affairs? According to the Congressional Budget Office 2012 report, VA spent about $2 billion in fiscal year 2010 to treat veterans of Iraq and Afghanistan wars. As compared to the total expenditure was $48 billion. Out of the $48 billion, $2 billion went to the Iraq and Afghanistan war. From 2002 through 2010, VA spent about $6 billion on health care for veterans involved in Iraq and Afghanistan wars. So there's clearly and always a need for more cost-effective treatment modalities within the VA to treat veterans, especially those with PTSD. Now talking about the role of diaphragmatic breathing for stress management and anxiety management and anger outburst, as we talked about earlier, those are the primary symptoms of PTSD. So according to Beals and Nunn, 2011, an anxious person's breathing is very shallow. She takes small breaths, raising her shoulders and upper chest muscles rather than the diaphragm. This causes too much carbon dioxide out of air passage and blood than what's being made by the body. If stressful situation doesn't resolve, chronic overbreathing can complicate other body systems such as chest tightness, chest pain, dizziness, brain fog, feeling of panic and anxiety, muscle stiffness, cold hands and feet, to name the few. Therefore, the authors suggested correct diaphragmatic breathing techniques for stress and anxiety management. Libby et al. 2012 presented a framework for using yoga as a specialized treatment for veterans with PTSD. Some of the practices that they discussed are yoga postures, mindfulness breathing, and meditation. Libby et al. Discussed importance of yoga along with breathing exercises protocols used in teaching veterans anxiety management skills. So one of such yoga techniques again is the diaphragmatic breathing. Varvoli and Darviri, 2011, discussed stress management techniques that are particularly useful for anxiety and stress disorders. The authors provided information on ill effects of stress on one's health, along with the importance of stress management to improve overall well-being. Varvoli and Darvini, 2011, further presented evidence-based techniques for stress management such as diaphragmatic breathing and mindfulness techniques. Therefore, diaphragmatic breathing is one technique that can be utilized to decrease stress and manage anxieties, again, two symptoms prevalent in PTSD cluster. While working on this innovation project, I collaborated with three members of the Veterans Intensive PTSD program. The first person I collaborated with was the team lead for the VIP program. The team lead is a clinical psychologist in the program. Her specialty includes PTSD and substance abuse treatment therapies. She is a firm believer of using technology as a mobile application to enhance current therapies. She uses PE Coach, which is prolonged exposure therapy, app developed by the Department of Defense and VA in her one-on-one sessions with veterans. This app allows veterans to track their progress by the means of self-assessment and completing sessions as assigned by the therapist. She particularly likes the app as it attracts younger veterans and they're more likely to use it, as opposed to traditional paper worksheets. The team lead is a big supporter of mindfulness breathing for stress management and relaxation, and she leads one of the mindfulness groups provided in the VIP program. She often uses diaphragmatic breathing within her one-on-one therapy sessions to provide support and grounding techniques to veterans. She's in support to use Breathe2Relax within therapy as long as the group is not reliant on this as a primary or only tool. Collaborator number 2, a clinical psychologist in the VIP program. He's the new clinical psychologist in the VIP program. His clinical experience is in working with veterans with dual diagnoses of mental health illness and a substance abuse disorder. He has never used a mobile application in his clinical work due to his limited knowledge of how to download and use apps. He likes the idea of technology being part of therapy, as he noted it will be good for younger veterans that are tech savvy, especially if they can track their progress. He's also a big supporter of deep breathing exercises for stress reduction and has taught the skill to many veterans during his individual and group therapy sessions. He said, for some it works wonders and for others it's just breathing. According to the psychologist, anything that encourages participation is a convenience, for follow-through is a good thing. Collaborator number 3 is a psychology intern in the VIP program. So the psychology intern works under the supervision of the clinical psychologist and facilitates group, individual, therapy, and partakes in team meetings. The psychology intern has not used mobile application within her clinical training individually or in group therapy. However, she's looked into various PTSD-related applications such as PE Coach and PTSD Coach. She's in support of using mobile technology as an adjunct treatment with traditional therapy. She finds mobile app useful as they attract people who like apps and is willing to use it for therapy. She's a big supporter of diaphragmatic breathing and often leads mindfulness groups within the VIP program. She has had several opportunities to teach veterans deep breathing for stress management. As an intern, she's amazed by the new technologies that are coming forth in behavioral health, as in her mind, this isn't something you learn in school. She looks forward to learning more about the mobile technology and mobile application. Collaboration for innovation. So why collaborate with people? For intersection of innovation is one of the driving forces for an innovation to work. Johansson 2006 in his book described 3 main points of intersection for an innovation to work. Following are the ways that I incorporated Johnson's main points in my project. Number 1, movement of people. So as a healthcare administrator, knowing and understanding viewpoints of clinical staff, especially regarding mobile technology, assists me with understanding different views. Interviewing psychologists from various backgrounds gives me an understanding of their viewpoints into their fields and how the field of psychology is using or not using mobile technology. Number 2, convergence of science. It's important to have interdisciplinary team approach for any science to be innovative. So for this reason, I chose psychologists with various backgrounds, including our psychologist in training, our intern. I would also like to include our nurse practitioner and social worker into this as well, should I decide to incorporate this into the VIP group programming, as currently I'm working on a proposal at work to use Breathe2Relax as one of our protocols. Number 3, leap of computation. This refers to using technology for advancement of communications, and with Breathe2Relax in itself, it being a technology-based therapy, this increases communication and dissemination of information with the various functions that this mobile app has. So what is Breathe2Relax? Breathe2Relax is a mobile application platform that's a portable stress management tool utilizing hands-on diaphragmatic breathing exercises. breathing exercises have been documented to decrease stress response and help with anxiety, mood, anger management by using mindfulness breathing techniques. Breathe2Relax can be used as a standalone stress reduction tool or as an adjunct therapy with the mental health care provider. The mobile app uses background and music that can be customized, setup guides for customization, tutorial videos of diaphragmatic breathing, body scanner to display effects of stress, graphing to track effectiveness of the module, and audio narration. The user can also record their stress level on a visual analog scale and track their progress in a provided chart and log. Breathe2Relax is developed by the Department of Defense's National Center for Telehealth and Technology, T2, and the Department of Veteran Affairs. It runs on both Android and iPhone platform. These are some of the screenshots from the Breathe2Relax mobile application itself. Collaborator number 3 is a psychology intern in the VIP program. So the psychology intern works under the supervision of the clinical psychologist and facilitates group, individual, therapy, and partakes in team meetings. The psychology intern has not used mobile application within her clinical training individually or in group therapy. However, she's looked into various PTSD-related applications such as PE Coach and PTSD Coach. She's in support of using mobile technology as an adjunct treatment with traditional therapy. She finds mobile app useful as they attract people who like apps and is willing to use it for therapy. She's a big supporter of diaphragmatic breathing and often leads mindfulness groups within the VIP program. She has had several opportunities to teach veterans deep breathing for stress management. As an intern, she's amazed by the new technologies that are coming forth in behavioral health as Luxton, McCann, Bush, Mishkin, and Rieger presented smartphone capabilities that can assist in psychoeducation as well as tracking systems for the user. Breathe2Relax has such capabilities. They also provided evidence regarding the innovative features of smartphones that can be included in behavioral health treatments. The authors noted smartphone technology as a future of healthcare, which is what this class is about and what this project is about. According to Luxton et al., homework assigned in PTSD mobile applications assist with increase in treatment compliance as therapist checks patient progress through these assignments. Breathe2Relax provides such tracking logs that can be used for checking progress of a veteran by the veteran and the therapist. So they can use this as an adjunct treatment and use it together in conventional therapy. A report released in late 2011 shows that mobile health application market has experienced substantial growth in 2010, when these applications recorded revenue of $230 million. By 2015, revenues from mobile health are expected to reach $392 million. So really, this is a very good platform to start doing more research and start developing more mobile applications that are worthy of use, especially in the PTSD treatment realm. Williams 2012 presented the argument that mobile apps are innovative ways of connecting with patients as well as smart way to disseminate health information due to high usage rate of mobile apps. And smartphone apps provide useful functions that can be integrated into conventional manualized treatment for various healthcare deliveries from diabetes management to behavioral health. According to Johansson, leap of computation refers to using technology for advancement of communication. Again, Breathe2Relax in itself is a technology-based therapy that increases communication and dissemination of information with various built-in functions. The user can also record their stress level on a visual analog scale and track their progress in a provided chart and log. Breathe2Relax is developed by the Department of Defense's National Center for Telehealth and Technology, T2, and the Department of Veteran Affairs. It runs on both Android and iPhone platform. So in conclusion, Breathe2Relax mobile application is an innovative way to disseminate information in behavioral health. It could be used again as an adjunct treatment with conventional PTSD treatment and can assist with increase in participation and adherence, especially amongst younger tech-savvy veteran population. The next few slides are references for my project. Thank you.